Hi, my name is Laura. I just passed my NCLEX and received my certification as a registered nurse. So I'm a registered nurse in California. So I recently, in June of this year, graduated from UCLA's nursing program. When I applied to college, I applied to a 4-year bachelor's degree program at UCLA, and that is what I completed. So I got my Bachelor of Science in Nursing. My biggest advice would be to start volunteering early on. I think it's very, very key to discovering what your interests are, especially if you're interested in nursing, because you get a first-hand view at what nurses do in their day-to-day. You get to start interacting with patients, and I saw that that's what nurses did. So that's what really made me want to become a nurse. So I would say definitely start volunteering early on. Some hospitals also offer internship opportunities, so you can even get paid. Also, networking is super important. When you volunteer or do internships, always ask for people's contact information, always follow up with them in an email so they know who you are, and just being able to write about that experience when you do apply to college and apply to a nursing program, being able to say firsthand that you've already been in the hospital helping patients just really, really helps you stand out and really helps you get a feel for nursing and get into, that profession. I'd say for somebody going into nursing, communication is key. Communication is super important. When you are a nurse, you're going to communicate with a whole team of professionals. It can be a little difficult at first to not feel awkward, but with time, if you really practice, and like I mentioned, if you volunteer, you'll really get over the awkwardness and get really good at communicating with your patients. You want to be able to clearly and concisely communicate with doctors and other nurses, so you want to be a respected member of the team. I'd say you also need to have time management skills. Those are super important because as a nurse, you will have a lot of different tasks to do. You will have multiple patients depending on what specialty you're interested in. So you could have, 4 patients who all need your time, and you need to be able to manage your time adequately so that everyone is cared for in the best possible way, in the safest possible way. And I'd say being able to be a leader is also very important. As nurses, we are advocates for our patients. We have to be on top of it, and we have to be able to speak up and speak to others when we think that there's a concern, and that's also a skill that starts earlier on. I hope to come back to UCLA Nursing and UCLA Health as a registered nurse. My relationship with UCLA Nursing started early on when I was in high school. Like I mentioned, doing internship programs is very important. So I had the opportunity to participate in the first Turner UCLA cohort of students who were looking into the allied health profession. And so in my first experience at the UCLA Ronald Reagan Medical Center, I was blown away by the amazing nursing staff and how willing they were to take us and teach us and show us, the heart of nursing and how beautiful of a profession it is, and how just witnessing the compassion and just the dedication to really making a difference in every single patient's life really stuck with me. And then I was able to do my clinical rotations at the UCLA medical centers, and that really continued to foster my relationship with UCLA Health. And so I hope to return to UCLA Health as a registered nurse, to be able to continue to mentor students, to be able to continue to make a difference in the lives of the patients who are at UCLA, and to be able to help foster, a greater community in Los Angeles. I would definitely say to go for it. Nursing is a great career. You don't have to stay in one place or doing one type of nursing. As a registered nurse in California, I can go into any specialty that I choose. So I could be a labor and delivery nurse, I could be an ICU nurse, or I could be a home health nurse. It all depends on what your interests are. As a first-generation college graduate, I never saw as many people who looked like me, and that's one of the reasons why I really why I wanted to become and became a nurse, because there is so much need out there for nurses who are passionate about helping others. So if you really feel that passion in your heart, then this is definitely a great choice of career for you.